Hi, everyone. My name is Brian Gettle. I'm Director of Advocacy and Alliance Relations at Exact Sciences. We'd love to use the balance of the time here to take your questions. We see a few of those have already come in. Please feel free to submit those in the Q&A section at the bottom of your screen. Before we get to those questions, though, I do want to turn it back over to Paul for a moment to talk about some data we released last week on the next generation of Cologuard. Paul?
Thanks, Brian. Pleased to share some results that we announced last week. Very excited to report at least the top line data from our next generation multi-target stool DNA study. This study was modeled after the DeeP-C study, which I reviewed earlier. Over 20,000 participants were enrolled, and the trial was conducted between 2019 and 2023. This was really to look at an optimized, novel multi-target stool DNA assay panel. And you can see the data, the top line data that were reported on the right-hand side of the slide. We met all of our study endpoints and were able to improve all of these performance estimates. Cancer sensitivity of 94%, advanced pre-cancer sensitivity towards the bottom of 43%, with high-grade dysplasia sensitivity, the most histologically advanced form of precancer at 75%, coupled with specificity at 91%. And when we looked at colonoscopies that truly had no neoplastic findings, the specificity estimate rose to 93%. So more to come. These are the initial top-line results. We intend to present and publish these data over the coming months.
Thanks so much, Paul. And a few questions coming in. Tom, first one for you that just came in. What will we learn from NCI's Vanguard study on multi-cancer detection?
Thanks for that question. So, the NCI's Vanguard study is still in the planning stages. The design of it will be finalized after all of the individual research sites are selected and the leaders from those sites convene to work on the trial design. As we understand it now, and as has been proposed, it'll be a randomized study with 3 arms examining likely 2 different multi-cancer early detection tests, with really the primary goals of feasibility in the hands of the NCI. So they'll be looking for questions around implementation, safety, initial results with regard to cancer diagnoses. It will not be powered for definitive long-term outcomes.
Thanks, Tom. Paul, now one for you. Does Exact Sciences have a patient assistance program for uninsured Cologuard patients?
Yeah, great question. Answer is yes. Through all of the hard work by the teams, over 94% of all Cologuard patients have no out-of-pocket costs for screening with Cologuard. For those who might face financial challenges with respect to use of this test, Exact has established a very robust patient assistance program. One key component is that the complexity and the burden of the patient to fill out forms, et cetera, has been dramatically reduced. There are additional details available at Cologuard.com.
Thanks, Paul. And Tom, I want to go back to you for a moment. We had a question kind of looking for some clarity about the false positive rate with the MCED test and how we sort of navigate what sort of costs may be incurred due to false positives.
Yeah, thank you for that question. So I want to bring a little bit of clarity to the numbers that we're talking about. So when I've said that 2/3 of positive MCED results are false positive, I just want to remind the audience that 98 to 99% of MCED results are normal. So we're now talking about 2/3 of that 1 or 2%. So these are relatively uncommon events. It's actually a much lower proportion than with current standard of care single cancer screening tests such as mammography, FIT or Cologuard, lung cancer screening, and so forth. So we anticipate that as MCEDs move forward, about 98 to 99 people out of 100 will receive a reassuring result. And that's true of our MCED as well as that of others. And about 1 or 2% will have a positive result. 1/3 of those will represent a cancer, and about 2/3 of those will represent a false positive signal. So thankfully, they're pretty darn uncommon.
Thanks, Tom. A reminder, we do still have a few minutes left for your questions. Paul, one more for you. We got a question in about coverage and access to Cologuard for high-risk individuals.
Yeah, so just to point out that Cologuard is approved and indicated for average risk colorectal cancer screening only. It should not be used as a replacement for colonoscopy in high-risk populations. Now, the question is an interesting one, and there are some R&D activities that we've been exploring to try to understand what additional markers might be possible to detect from stool, and could we develop another stool-based molecular assay to look for conditions like Lynch syndrome and the associated DNA mutations or other indicators of that genetically high-risk population. At present, anyway, we don't have those assays available. So again, Cologuard is for average risk colorectal cancer screening only.
Thanks, Paul, and thanks so much to you and to Tom. And also, just on behalf of Tom, Paul, and the Exact Sciences team, we really want to thank the Prevent Cancer Foundation for the opportunity to present here today. With that, we will turn it back over for the rest of the Dialogue Conference, and thank you so much for joining.